This month marks the 1 year anniversary of a new world impacted by the coronavirus. On Sheila Lives Out Loud this week, I share the experience of putting together episodes that we uploaded over the past year about the pandemic. From learning new terminology like social distancing, isolation, PPEs, and even more complex questions like why is it that not everybody who was tested positive got severely ill. If you'd like to take a look at the year that was with me, let's get going. And please remember to click subscribe and hit notifications for more content from this channel. I just kicked off a new season of Sheila Lives Out Loud, and faced with so much that was unknown, it was paramount to me that this channel share anything I was learning with you. I couldn't possibly be the only one who had so many questions. I knew I had to provide a channel and an outlet where I was able to share with you the information that was building me and helping me cope with the situation and sharing that with you. And so I called up my good friend and Secretary General of the Kenya Medical Association, Dr. Simon Kigondu. Yes, he was the first medic that I spoke with last year, and he helped us get a basic understanding of just what we were dealing with.
COVID-19, as I said, is a short form for corona, V, virus, D, disease, 2019.
Right.
Coronaviruses are a group of several viruses, but this particular one that is causing an infection, a pandemic across the world, was specifically described as one of the coronaviruses, and the disease started in 2019, hence COVID-19.
Okay.
So corona is just a group of viruses, but this particular one is coronavirus 2019 that is causing the disease that is causing a pandemic.
I see. So one of them is defining the disease, and the other term is really just defining the virus itself. Moving on to symptoms and signs, what is the difference between a flu and having COVID-19? Because not too long ago, everybody was saying, but it's just like a homa, it's like a flu, and it passes. But clearly, there is a distinction between the two.
Coronaviruses do cause flu-like symptoms. Now, how does a body reacts to a foreign body the same way? It reacts to, for instance, if something is, and this particular one is a foreign body that affects the nose, throat, and the lungs. Yeah. So when the body, you have some irritant, so to speak, whatever it is, it may be a virus, a bacteria, or it is, the nose will react by producing maybe sneezing and a running nose. The back of the throat, which is a common place where specimens for this coronavirus are taken, react by, you get that irritation and you may get a dry cough. And now if the coronavirus reaches the lungs, it may attack the lung tissue and destroy it, causing what is called inflammation of the lungs, which is a pneumonia. And if the lungs are inflamed, then the air exchange is not occurring very well, and you may start getting difficulty in breathing. Because if you have a part of the lung that is damaged, then the oxygen exchange and carbon dioxide excretion is not good. Therefore, people sort of try to gasp for air. That is lung damage, is a pneumonia. So the signs are the same. So when a body gets infected, then there is something called cytokines, which are things which go to make the body, therefore you start getting a fever, things which trigger fever, that go to show that maybe there is an invasion by a foreign body that is generally not supposed to be there. And therefore the common signs are these ones. In this particular one, and as we said, there are some coronaviruses cause flu-like symptoms. And what are the flu-like symptoms? Our usual flus of sneezing, cough, running nose,
Running
and
nose,
coughing.
headache as well, I think.
of headache may come if it invades the sinuses.
Mhm.
Yeah. So these symptoms may have similarities. So what we are saying, when you get this particular one, you may actually get similar symptoms. But we now need to really see, where did this person come from? Are they coming from a place where this has been described as a pandemic? For instance, initially it was China, then proceeded to Italy, now the whole of Europe, and now slowly it's getting some African countries. Like, I think the highest currently is South Africa, and now in Kenya we have several people with a positive test for COVID-19. Therefore, the case definition keeps changing, and it's going to start including places like visiting a positive patient in Makati, for instance,
Yeah.
and therefore that is the situation.
I'd like us to move very quickly to how the coronavirus spreads.
So the classic, for the virus to enter your nose, throat, mouth, then the virus has sort of to be transmitted to the nose and the mouth. Yeah. And how that is done is that when the virus is found in droplets is like, if you ever see someone sneezing, then all those droplets of saliva and mucus, sort of, the virus is there, and it may land on a surface. So it may land on a surface where, if someone touches that surface where the virus is there, then touches the nose, then breathes in, then the virus can actually land on the mucous membrane of the nose and the mouth and start multiplying there. If someone sneezes directly at you and you see droplets, you can actually breathe in these droplets. And therefore, the primary prevention is actually preventing contact with these droplets.
Okay.
You see?
Right.
And how do you do that? One thing that we have recommended is that avoid droplets, wear mask, for instance. Ideally, if I was to give a recommendation, I would actually recommend that everyone keeps their own droplets by having a mask. You can make it out of old clothes and all. So if everyone walked around, then they reach a time where these droplets are not being transmitted from person to person. But what they are saying is, if someone is infected, avoid direct contact with them. And that's the concept of quarantine. The concept of quarantine is remove the person who has active infection. And because we may have a window period where we don't know someone who is infected, then if people who are kept away may be people who have traveled, and there's the possibility that they may have come in contact with the disease, and therefore you keep them away for some time. They have also said that this virus, if you wash with soap and water, then the soap helps eliminate the virus, and water also washes it up. So good hygiene practices prevent these droplets from the virus from coming in contact with you. 60% alcohol and above then is also effective in cleaning the bacteria.
This is using those hand sanitizers.
So sanitizers are a hand sanitizer basically is alcohol with a stabilizer, like glycerin, so to speak, so that it's able to run. But other people have also been using literally alcohol, like spirit. As long as it's 60% and above, and this helps prevent these viruses.
So testing and why it takes so long. How is the process? How do you test for COVID-19, and why does the process take several days?
So the testing is simple. You go to where you think the virus is multiplying, the back of the nose and the throat. And this is, the people taking a test have to wear that spacesuit, It's called a hazmat, So to prevent themselves from getting the disease, then they take a specimen from the suspect, and it's put in a viral transport medium. This viral transport medium is kept so that to preserve the material from, if you expose the material to sunlight and you may break out. It's taken to the specialized labs who do what is called a polymerase chain reaction. They go and put it in the media, grow it, so to speak, and then they go and look at it under a microscope and say, this is actually that particular virus. And that takes time. And that's why we've been having a bit of slow increase in the number of labs that can do it because it's slightly specialized. And then the test media need to be available, and which is sometimes not very available. And
It's
therefore,
also
it takes
a
a
challenge.
minimum of 6 hours. A minimum of 6 hours.
Armed with this introduction to the virus, I wanted to know why was it the case that not everybody who came into contact with the coronavirus ended up desperately ill. And this began with a step-by-step guide on what happens to an individual right from exposure to the virus from Professor Reena Shah, the section head of infectious diseases and the fellowship director for infectious disease fellowship program at Aga Khan University.
So if you're exposed to the coronavirus, and as you said earlier that it's through contact, right? So either you breathe it because somebody is coughing or sneezing near you, or you touch something, you touch a surface that has the virus and you touch your mouth or your nose and it enters your mucous membranes. What would happen is one of three things. One is that it doesn't enter your mucous membranes. You can touch your mucous membranes, and your mucous membranes are your first line of defense. So it doesn't enter it. Okay, so not everybody who has virus entering the touching the mucous membranes will enter. So it doesn't enter. The second thing is it enters, and your body's immune system is so good, it gets rid of it. Our mucous membranes are very good. It's our first line of defense, the first soldier. If it were to enter the mucous membranes, then we have what we call our own immunity that takes play. So our immunity tries and attacks the virus. And depending on whether it's successful or not, it depends on your type of immunity, on whether it can get rid of it or not. So if it gets rid of it, that's it, it's done. Or it can enter the mucous membranes, and then still your blood and your other defenses go into play, and you get what we call mild symptoms. And as the mild symptoms are happening, your immunity is also at play, trying to get rid of the virus. So those people get mild infection. So you get a few days of infection and you get better. Right? Like the flu, the normal flu we get, we're unwell for a few days and we get better. But if it overcomes your immune system, then the virus goes into your lungs and causes all the moderate and severe symptoms that we're reading about in the news. It's the 15 to the 20% of patients, of all patients who get coronavirus, that get moderate to severe symptoms. And out of that, it's the 5% that get the severe illness and end up in ICU.
All right.
The reason we're doing the social distance, is to reduce the number. We want, if we have 15% of 100 is a lot easier to manage than 15% of 100,000.
Right.
And that's why we're doing social distancing, to reduce the total number that get infected.
Professor Shah then took me through what happens from day one after being infected and what the body goes through.
Once you've gotten infected and it's past your mucous membranes, first day 1 to 4, the body is trying to fight it. So it doesn't go any deeper. Right? You don't want it to go into the lungs, or you want minimal amount to go into the lungs. So that's day 1 to 4. After that, once it's in the lungs, it goes and infects the lungs. And when it infecting the lungs, it prevents gas exchange. As we know, basic biology, we breathe in oxygen and breathe out carbon dioxide. Now, if it's affecting the lungs and making them what we call stiff, and not allowing them to go through the gas exchange, your body is not able to maintain its oxygen saturation. Your oxygen saturation needs to be at about 92%. So if I were to do my blood test or yours and look at an oxygen saturation, we're at about 90% plus. But if the gas exchange cannot happen and you cannot breathe in adequate oxygen, your oxygen level goes down. And that's when you need what we call supplement oxygen. And that's why you see all these pictures of patients with COVID having oxygen initially. Then as it infects more, your body is fighting it. It's fighting it, causing what we call inflammation, causing swelling of the lungs. So when that's happening, you're not able to exchange gases more. You cannot even maintain your oxygenation with supplement oxygen. So after that, days 5 to 8 to 10 is when that's not happening. You end up having to use a ventilator. Of course, as doctors, we monitor that. So we monitor patients who come in, we put them on oxygen, and hopefully that is enough. So we're doing the oxygen saturations regularly. But as we see the saturation going down, even on oxygen, then we have to make a decision on ventilating the patient. What we mean by ventilation is we're actually artificially taking over the function of the lung to maintain that gas exchange, to maintain oxygen. As we know, we need oxygen in the body for all our cell functions, for our brain to function, for our kidney to function. So if we don't maintain that, all that shuts down. And that's the process. Having said that, not everybody who's put on oxygen goes onto a ventilator.
Right.
There are a lot of patients who are on just the ward, in the wards, or put on oxygen. We're supporting the lungs, helping them, and they get better. So not everybody who's put on oxygen ends up with a ventilator, but in the worst case scenario, that's a progression.
In speaking with Dr. Kigondu, it was clear that the elderly and those with pre-existing conditions were especially vulnerable, and Professor Shah helped us know which conditions were especially the hardest hit.
Comorbidities is having another condition. So you can be well and going with your normal daily life, but you can have other illnesses, like you mentioned, HIV, you can have diabetes, renal dysfunction, cardiac disease. So those are comorbidities. So people living with conditions other than coronavirus. And then if you have those conditions and you get coronavirus, it's like getting a double hit. From studies abroad, from China, Italy, UK, US, we find that patients who have diabetes, heart failure, seem to have worse disease than the people who do not have. So if you take a 50-year-old individual who's got no comorbidities and has diabetes, we find that a patient who has diabetes has severe form of the coronavirus. Now the million-dollar question is, here in Africa, we are the epidemic of HIV. We have majority of the HIV patients are here in sub-Saharan Africa. How is this disease going to play with us here? We don't know yet, because we're in the early stages, what we call the early stages of the epidemic. Italy is in the mature form of the epidemic. China is past the epidemic. So we have different phases of epidemic. So this is early. So my advice is, if you do have a comorbid condition, whether it's diabetes, whether it's HIV, you've got to be very careful. I mean, the social distancing should probably go a bit beyond that into social isolation for the next few weeks. I tell my patients and my friends, really look after yourself, because you are more at risk of not only getting the coronavirus, but getting a more severe form of the virus.
Knowing that a significant number of Kenyans live with pre-existing conditions, I then reached out to 27-year-old Doreen Mora Moracha, who was born HIV positive and is a social media influencer and HIV positive advocate. Early on, when little was known about HIV, the stigma that was associated with being HIV positive was astounding. And while we were beginning to learn more about the coronavirus, testing positive for it was also stigmatizing. And so I reached out to Doreen to speak about stigma and being a high-risk individual due to her pre-existing condition.
We have been given the safety practices: stay home, sanitize, wash your hands, and all that. Personally, I'm actually working from home, so I'm trying as much as possible to stay safe, because the weird thing about this, I've actually seen this thing on people on social media saying the thing with COVID is we are being told there are 800 cases, we don't know the 800 cases. It is the same way. There are 1.6 million Kenyans living with HIV, and there are people who don't know that these 1.6 million Kenyans have HIV. So it's not about having a face to the virus. It is more about knowing that that virus is real. It is there. It is, people are being infected, people are being killed. People are dying from it. And you have to stay safe. You don't just go out and say, if I'm going to die of COVID, I'm going to die of COVID. And you just become careless about it. You have to stay safe, because you don't know who has it, you don't know who does not have it. Also, for people with underlying health conditions, at first, people used to say that if you're healthy and the immune system is okay, then you cannot get COVID and all that. It's only for older people and the people who are living with underlying health conditions. But that is a lie, because anybody can get COVID-19. It is just that people with underlying health conditions are more susceptible to getting it and they are also more susceptible to succumbing to it than people who do not have any other health conditions. But then we have seen that people are getting healed, their recoveries. So all I can say is, whether you have a health condition or you do not have a health condition, just stay safe, because you don't want to expose yourself to the virus just because you feel it's not going to target me. The virus is not a respecter of anybody. It catches anyone. It doesn't matter whether we have seen a case of a child as young as 6 months. So that means that it is a virus for everybody. So it's all about people to stay safe. For people with underlying health conditions, ensure you have your medication. Because for people with HIV who are undetectable, they say when you're undetectable and the virus level in your body is low, then your chances of actually recovering from COVID, if you have it, are very high. So stay undetectable, ensure you have a good supply of ARVs, ensure that you are taking a lot of vitamins and boosting your immune system, because right now we need boosted immune systems. Also, on the issue of stigma, stigma is mostly brought about by myths and misconceptions and fear. And so far, we have seen a lot of myths and misconceptions about COVID and a lot of fear spread about COVID. So we need to break away that stigma barrier, and that we don't really need to have another case of HIV where there is too much stigma. People don't understand the virus, so everybody has their own theories about it. Let us get the facts, because there are facts. Let us know the facts and have them, and know that this is what there is so far. This is what people have understood about COVID so far, and we go with them. And let us not stigmatize people who we know have COVID, because they are also human beings. Remember that this virus is a virus for humans, so treat them as human beings.
Well schooled on comorbidity and stigma, I had to have a conversation with my friend, Dr. Tasnim Yamani, a medical practitioner certified in geriatrics. In knowing more about COVID-19, it was clear that care for the elderly would have to step up. And it started with understanding why the elderly are so susceptible.
What we know about it, as you know, what we know about COVID-19 is very limited, because it's something we're all dealing with for the first time.
Yeah.
But what we do know is that it has, maybe the word is, it has an affinity for people who are immunocompromised. Mm-hmm. And age on its own is an immunocompromised state, because your body's defense mechanism are lower. Age comes with comorbidities, which again keep you more immunosuppressed. So you're highly more vulnerable to a severe attack of COVID than somebody who may be in prime health in a younger age. Mm-hmm. Not to say they're not at risk. We are all at risk,
right?
But it's the kind of symptoms and the severity of the illness is far worse in people with any kind of comorbidity, and of course people above the age of 60.
Right.
And that lies in the space that I love the most, the geriatric people.
Yeah.
They're more vulnerable to this, and that's why I think you keep hearing it. If you're over 60, please stay at home. Mm. But we also have to remember, for a 60-year-old who has been up and about active, that one statement is probably like a life sentence right now.
For the elderly, an assessment of a healthy person includes social connection, but COVID literally torpedoed that dynamic. Making contact with grandparents became difficult. Benching those who were elderly yet independent members of our society was definitely going to have an impact on their mental well-being. And here's what Dr. Tasnim recommended to keep socially connected despite social distancing.
The people who are alone, I think the best way we can reach out to them is create a hotline space, and with the hotline space, have a way of reaching out to them, with a database. I know a lot of communities are doing that. They have put together their database of their community older persons, and they've created a group, a task force, that makes calls to them just to find out on their well-being, find out if they need anything, if they need any door-to-door service, because not everybody is tech savvy, especially on online ordering. And you really don't want your 80-year-old or your 60-year-old who was fine being in the supermarket unless absolutely, life or death. So, try and do their ordering for them. Try and, create that. And this reaches out to all community members, because it's the easiest way we can. As we know, the government is really overwhelmed. So we can support our government. And the best way to support the government is by, using our community groups to create a database for the older person, make phone calls as younger people to identify their needs, identify their situations, have a 5-minute conversation if they need, their daily day-to-day
Medication even.
medication,
Yeah.
their food stuff, if they need a meal. We can organize through, we have so many apps that do online. Most supermarkets have gone online.
Yeah.
So the best way I can think at this point is a community outreach for their community members.
Dr. Tasnim also made mention of the elderly's diet.
Hydration is key, of course. Keep them well hydrated. The weather is changing really drastically. It's really hot right now. So even though we are indoors, hydration is key. A lot of fresh fruits, vegetables, of course, keep in mind the diabetic diets and things like that. A lot of, good, healthy, raw foods is the best way to go. So when I say raw foods, I don't mean eat your lentils raw, but you get what I mean. Do less oil, the usual healthy diet, but a lot of fresh fruits, fresh vegetables, salads, carrots, cucumbers,
Right.
A lot of water is really key.
And diet wasn't just the only key variable in the care for the elderly. It was something that would affect all of us. And that was from a conversation with Dr. Estan Dindi, better known online as Dr. Fitness.
We are created to be social. We crave just that connection with other people, and physically so. And imagine now we are called upon to observe social distancing, no shaking hands, no hugs, all those things still have an impact. Before you even impose a lockdown and the limited movement and the curfews, and so if there's a curfew and you wanted to visit someone some towns away, and you have limited time, you might not be able to do that. So all those have a lot of impact on our health and our well-being. They have impact on us emotionally, socially, and even physically sometimes. And because of all these stressors coming together, because as human beings, we adapt differently. Some people are likely now to revert to, okay, I'm not able to meet Sheila and have a chat over coffee or whatever. Then you find yourself just munching, your fridge is stuffed with some things, and we are different. Some people, when they're stressed, they will not eat. Others, they will tend to eat comfort food. And comfort food tends to be, the things that are loaded with what I call the fattening diet, as in, it has fats and carbohydrates combined together. That's quite toxic, So the thing is that happens. And then the other thing, the reality is that most people are restricted in just movement, like not even just traveling away, but getting outdoors, going for the walks, going to the gym.
Gyms were shut down as well, no?
Yeah,
So
they were.
What we're going to do here.
Yeah, so and I think it took some, a lot of mind shift and shift of habits. For me, I think it didn't affect me much, just because I've always trained at home. I don't use a lot of weights. I have a few weights, there's some dumbbells, things I can just do at home. So that didn't affect me much. But for some people, it was really such a great change, and adapting is not easy. Before you shift and realize, okay, I need to start doing something else. Maybe you're used to lifting heavy weights, and now you can't do that safely at home, and trying to start doing other things can just take a toll on someone's thinking and emotional well-being. So truth be told is that this COVID has really changed the way we look at things, and I actually believe things will never be the same again, even post-COVID. It has also made the online space become just a big platform. You're more conscious of it, just because you realize that, hey, I might not be able to go check on my mom, but I could call her, I could Zoom chat her, video conference, like my family, my extended families now, we meet online every 2 or 3 weeks and just chat and have a sense of connection, but it's always different from meeting physically. So all that said, it's just good to remember that as much as there are all these concerns, and as much as we are restricted, we can't live life as normally as we were used to. We have to adapt to a new normal, and knowing that by limiting how much you're doing your comfort food, eating the right things, or facing your stressors as opposed to stuffing your face with food, is going to make a lot of difference. So the thing is that we have to realize that the habits we carry on are likely to influence how much we are at risk even, of having a bad disease with the COVID itself.
With accelerated widespread community transmission, there were different measures that were put in place, ranging from travel restrictions to curfews, but taking responsibility and stepping up personal self-care and helping our body's own natural defense mechanisms was a personal exercise not to be trifled with. So we spoke together about comfort food and the impact that some of these measures had on most people.
What has happened over time is that we are past the shock phase and we are accepting, hey, this thing is here. We don't know for how long it will be with us, so we might as well move on, but not neglecting what we can do to keep ourselves safe. So we still need to move and look for ways for moving and getting outdoors. And hey, if you can bask in the sun, some vitamin D is good for our health and boosting our immunity as well. So that would go a long way in even giving us a sense of well-being. Being locked in and staying just indoors has a depressing effect in itself. So just getting outdoors, breathing a bit, observing the social distance as well, just trying to connect to people that you love and love you back, whether it's via online or, sometimes you can chat to your neighbor over the fence, those things can still be done, but we need to ensure that we are healthy. We need to check on people, be checked on. You can call a counselor if you think you need that kind of help, but we need to ensure that we are not only fit in our bodies, but in our mind and emotionally as well.
Why you do what you do is a key driver to the habits and patterns that you have. And Dr. Fitness had the following recommendations.
When it comes to food, I think I would start by saying first it's good to start with a good mental food. I know before you think of the food you actually put in your mouth, the food you put in your mind matters a lot. And this is because if you're really stressed, you're also less likely to make good, healthy food choices, as in the edible food. So just having our minds of a lot of distractions and also not tracking a lot of what is happening can actually be protective. They say ignorance is bliss. Sometimes it actually is. If you want to really track what's going on, you can either follow Ministry of Health, releases, or follow WHO, CDC. Of course, that might sound so global, but you get to know what's happening. But if you keep watching the news and following everything, sometimes it can be so overwhelming, and you'll be feeding yourself with so much of negative things, and it can become depressing. So feeding yourself on what's positive and just waking up and just being grateful that you're alive, thanking God that you're alive, starts you on a positive note, and you're more likely to have a better sense of well-being, and therefore you're more likely to go shopping for the right foods. And I like to encourage people to go for colored foods, as in have as much vegetables as possible, whether it's cabbage, purple, green cabbage, have Swiss cheddar, skuma wiki, all sorts of vegetables, the aubergines, as much as you're able to have and afford and is accessible to you and you're actually able to tolerate. Because of course, vegetables not only have, they have vitamin K, especially the green leafy ones, they have beta carotenes that's converted to vitamin A, they have some minerals in there, and other vitamins as well. But the other thing is that they also have about protective things that we call the phytonutrients that are beneficial to the body, that carry out antioxidation and that kind of stuff. So it's good to have lots of vegetables. It's good to have a wide variety of fruits, but the fruits come in season. So enjoy the ones that are in season, but don't go overboard, because I like to remind people that fruits, of course, are rich in natural sugar. And please eat whole fruits, don't drink the juice, and just because the juices have concentrated sugar. And then, of course, you need a balance there. So you'll still need a bit of protein, because our body is made of protein. It will help you deal with cravings, because many times the foods we crave have a lot of carbohydrates, and the more we eat the carbohydrates, it just drives the cravings more and more. And so, like you have said, it's good to focus more on introducing the good things than just doing away with the bad things. So the more you introduce the good things, the vegetables, the fruits, the healthy proteins, some healthy whole carbohydrates that are not so much processed and that are not deficient of fiber, and then of course some healthy fats, have some nuts. The more you fill your diet with more natural whole kind of diet, then you're going to be satiated and have less room for eating the junk things. So when you start with that, you'll be fairly full by the time you think of your dessert or something sweet or something to drink and all that. So focus on introducing the healthy things and eat more of those, and with time you'll have less and less cravings of them, of the bad stuff. Of course, we all start from different points, and if you're just beginning to embrace the healthy lifestyle, it might feel like it's a challenge to be able to do away with things you almost feel addicted or so hooked to.
Now, all these snippets are from conversations that are on this channel. Simply scroll just a little bit for those that don't have the links attached. But I hope you've gained some new insights on this pandemic and especially your role. Restrictions remain in place in Kenya for another 60 days, maybe less, but please stay safe. Next week, we're going to complete part 2 of a look back at what we've learned with a focus on mental health, home care, and experiences from Kenyans who've had COVID. Till then, please follow the protocols and subscribe to this channel. Live out loud in all that you do.